Well, the U.S. Surgeon General says loneliness is now a public health threat so severe that it's on par with smoking and obesity. CBN medical reporter Lorie Johnson explains why it's become so widespread and how we can begin to reconnect with others.
America's top doctor sees loneliness as a painful secret affecting far too many Americans, including himself.
Because this is an issue so many people struggle with in the shadows, and they don't talk about their loneliness because they feel ashamed. And that was true for me as well.
Like many others, Dr. Vivek Murthy experienced it as a child and again as an adult.
It was my wife, Alice, who stepped in and said, "Hey, I'm worried about you because you're not reaching out to people, you're not socializing with your friends."
Research shows loneliness increases the risk of physical ailments like heart disease, dementia, and stroke, plus mental ones including depression, anxiety, and suicide. Doctors find the possibility of premature death due to loneliness could equal that of smoking 15 cigarettes a day and greater than living with obesity. New surveys show as many as half of adults are struggling with loneliness, and even greater numbers of children are. That may seem surprising since children appear to be connecting with each other on these things all the time. Technology, however, serves as a poor substitute for in-person connection, experts are learning.
I actually believe we're on the beginning of a tidal wave of brain and mental health problems in young people. And it's because we're just more disconnected than ever before, disconnected from our own families, because when people are together, their faces are buried in their gadgets.
Psychiatrist Daniel Amen blames the pandemic for making this problem exponentially worse. He believes we can turn things around by cutting back on screen time and returning to in-person activities.
So it's back to church. Go back to church. Get involved with groups. We have to go back. We need to come together to solve it. And really no better place to solve it than a church.
Dr. Amen also believes the government should put more resources into hiring and training mental health professionals so they're more accessible and affordable. Lorie Johnson, CBN News.
An important report with sobering statistics. Gordon?
Well, if you have teenagers, if you're letting somebody who's not a teenager have one of those smartphones, rethink that and make sure that they know how to socialize. It's amazing to me to see young people literally in the same room, and instead of talking to each other, they want to text each other. I don't understand that behavior pattern, but they seem to. And is that going to lead to increasing isolation, where your only outlook in life is at a small screen and a handheld device? That is going to lead to mental problems. It is going to lead to things that we're just now in the beginning, as that expert just said, a tidal wave of that. So as parents, as grandparents, let's do our job to say, no, could you please look at me? Could we have a conversation? Can we talk about your day? Can we discuss things, and in that, bring them out from those kinds of devices that so want to, they're literally wired to be addictive. They're literally wired that if you're not paying attention to that device, that somehow you're missing out. Well, no. Have those conversations and please press the issue, force the issue.